I'm Dr. Lavanya. I'm a consultant gynecologist obstetrician. I work in Cloudnine Hospitals, Hyderabad. Laughing gas or nitrous oxide is used in early labor as a pain relief method. In this, the mother is using a face mask and she is inhaling the nitrous oxide mixed with oxygen while the peak of the contraction. The mother to ride through the contraction phase, and the mother feels the control of using it because she is directly using the face mask. Sometimes the contractions may become effective and nitrous oxide doesn't work in the second half of labor or the active phase of labor. The main side effect with using a nitrous oxide is complaints of nausea or vomiting or a claustrophobic sensation by the mother using the face mask. The advantage of nitrous oxide is it doesn't linger in the woman's body or the mother's body or the baby's body, and easily available, readily available and easily administered self by the mother.